Good morning. Today we're going to talk about a quality improvement plan for the diabetes management program within the Lake Charles Community-Based Outpatient Clinic and the Alexandria Veterans Healthcare System. The reason that we need to improve this program is because the veterans' glycemic control is not where it should be, as evidenced by the lab tests that we're seeing A1C levels of 9.0 and above. The veterans are not able to get the education that they need to be able to manage their diabetes on their own. Right now we have 15-minute appointments with the RN care manager every 3 months. Lab tests are drawn every 6 months. So every 3 months, a 15-minute appointment is not sufficient to be able to educate these veterans. This is verbal education, not any printed materials or visual representations. We now have a nutritionist within the Alexandria VA healthcare system who can do telehealth visits, which telehealth visits modalities would be telephone visits or video appointments. The aim of this improvement program is to provide quality education to the veterans. And we want to see a improvement in the A1C levels of these veterans. So if their A1C level is currently 9.0 to 13.9, then in 6 to 12 months, we want to see an improvement of an A1C level below 9.0. But if their A1C level is 14.0 or above, which we have 12 veterans in the entire clinic who have an A1C level of 14.0 and above. We want to see a drop of 3 points in 6 to 12 months. This program is not just for veterans with an A1C level of 9.0 and above. It's for all diabetic veterans. So even if they have an A1C level less than 9.0, so 8.9 and below, we want to see a steady drop of that A1C level till it reaches around 5.5 to 6.5-ish. So this education is for all of the veterans. If they have better education, they have better diabetes management, and this leads to better quality of life and better health outcomes. We always want the veterans to have a support person with them, and just in case the veteran can't comprehend what we're telling them, because a lot of our veterans are elderly, so their memory is not what it should be. And even if we do give them the printed materials and do the visual representations, some of them might not be able to remember that. So a support person is a great thing to have, especially in diabetes management. So the new appointments will be 30-minute appointments instead of 15, every 2 months instead of every 3 months, with the option for the veteran to schedule before then. So if they want an appointment in a month, they can call and get an appointment in a month. So lab tests to check their A1C levels will be done before every appointment with the RN care manager. So it'll be every 2 months instead of every 6 months for those labs. Appointments can be made with the nutritionist now every 2 to 3 months via telehealth. So for telephone calls or video appointments, because she is located up in Fort Polk and is not local to our veterans. For the printed materials that are going to be given to the veteran, this will include a packet that includes websites available for more information for them, education on the signs and symptoms of hypo and hyperglycemia, the effects of poorly controlled diabetes mellitus, because if veterans can see the effects of them not complying with the program or with their diabetes management, then I hate to say it, but sometimes this can scare them into complying and having a better health outcome if they see what it can do. So they're going to have smart dietary choices in this packet. The Mediterranean diet is a great one. The American Diabetes Association diet, we'll have those printed out for the veterans and their support person. The packet will also include how to use their diabetic equipment, such as their glucometers, continuous glucose monitoring, insulin pumps, but we'll also do a visual representation of this also. Each veteran will have a printed medication worksheet from their chart that tells the medication, how it works, and when they need to take it. The veterans that are on insulin with a sliding scale will also have a sliding scale page that explains their sliding scale. The visual presentation of each program will be how to use their equipment, proper serving sizes. So we will have a plate that we have ordered. Fortunately for us, we were able to order this with our own money because it wasn't too expensive. It's a plate that has portion sizes of each food group, and that way we can use this to show the veterans how much they should be eating instead of how much they are eating. The visual representations will also include exercises that they can do at home, especially if they're non-ambulatory. So leg exercises, arm exercises, and also exercises that they can do if they are ambulatory. Especially if they have a walker or something like that, we can do small exercises with someone there, of course, so they don't fall. So how are we going to know that the program is going to work? And this is what we want to hear and what we want to see. The veteran and the support person, they need to be able to answer questions that we ask correctly. So we're going to ask at each appointment about what they learned at the last appointment. We're going to bring out the serving size tray, and we're going to ask if they can show us the proper serving size of a starch. Can you show me the steps that you need to take your blood sugar with your glucometer? Other questions, what did the nutritionist speak with you about? Because we can see a note from the nutritionist, so we will know what they talked about, since we can't be there for that appointment. So we're also going to ask them what to look for on nutrition labels when they're choosing their foods in the grocery store. So, or when they're at home and they're looking for something to eat, we're going to show them and ask them later on how to look at the nutrition labels, what they need to look at, so the carbohydrates and the sugars. And we also want them to look at the fiber, because the fiber is a carbohydrate. So we want them to look at all three of those. The objective measures that we want to see are going to be a loss of weight. So we'll also weigh them at each appointment. And then the A1C and the diabetic urinalysis, we will run that every 2 months before their appointment with the nurse. We can also run these in between those at other intervals, especially if the veteran calls and wants an appointment with the RN care manager, say that they can't remember things that they were taught, or they don't understand some stuff in their packet, they don't have a computer to get on the websites, then we'll bring them in for another appointment, and we'll also do their lab at that time so we can see if there's been any changes. Foot assessments will be part of this program. A lot of the veterans, they can't see the bottom of their feet, and so we're going to show the support person, if they have one, how to do a foot assessment. Are there any red spots? Are there any open wounds? Are there any areas of neuropathy in their feet? Because this is going to be another telling thing that shows if their diabetes management is on par with what it should be. Because if they are getting diabetic ulcers and their A1C is not coming down, then we know that we need to do something else. So a few websites that will be beneficial to these veterans and also beneficial to other healthcare personnel, just to be able to teach at a quality level, would be the Johns Hopkins Patient Guide to Diabetes, and that website is hopkinsdiabetesinfo.org. The American Diabetes Association is a great tool for anyone healthcare provider or veteran or patients, period. And that website is diabetes.org. The U.S. Department of Agriculture, Diabetes Nutrition. So the U.S. Department of Agriculture has a part of their website that is dedicated to nutrition for diabetics. Things that you should eat, things that you shouldn't eat. This is a great tool. So that website is nutrition.gov. The Centers for Disease Control, cdc.gov. It's going to give a lot of information on diabetes in your area that you can see. The Academy of Nutrition and Dietetics, which is eatright.org. They have another great tool for nutrition and what you should be eating, what you shouldn't be eating. They can this along with the Department of Agriculture kind of bounces off of our visual representation that we had in clinic of how much to eat of each food group. And lastly, the Association of Diabetes Care and Education. This is diabeteseducator.org. This is great for healthcare providers, but it also has pages for diabetics, for patients, for the veterans. This is a great tool for anyone who has any dealings with diabetes or hypoglycemia. This is a great tool. So hopefully this program, we have started to implement the 30-minute appointments within the Lake Charles Community-Based Outpatient Clinic. After we implement the program and we start seeing some results, if they're positive results, like I'm pretty sure there will be, then we'll start implementing in other community-based outpatient clinics, because we have Lafayette, Jennings, Fort Polk, and Natchitoches also within the Alexandria VA healthcare system. We also have primary aligned care teams up in Alexandria. So there's RN care managers up there that do diabetes education. So if we can get this rolled out into Lake Charles and then spread it out into the other CBOCs and see that it works, then we'll be able to implement it within the entire VA healthcare system of Alexandria to help these veterans with a better quality of life and better health outcomes. Thank you.